Hi, everybody. It's Dr. Rebecca Griffith, the ED DPT, and I am here just to share a little bit with you about what I learned in my reading last week. And one of the articles that I read was this one. Patient Perspectives on Seeking Emergency Care for Acute Low Back Pain and Access to Physical Therapy in the Emergency Department by Dr. Howard Kim et al. And Dr. Kyle Strickland, who's a physical therapist at Northwestern University. We had them both on the podcast last season, so take a listen. But this article really was looking at the perspectives of why patients are coming to the emergency department for low back pain. That's a question I get all the time. Like, why are patients going to the emergency department for low back pain? Like, why would you do that? And I think for those of us who are physical therapists and really understand low back pain a little bit more, like why it does make sense, right? Like, why would you go to the emergency department for back pain? But what we really need is the patient perspective. And this article helps with that. They found several different themes in their discussions with the patient, and I'm going to share some quotes from each one that I thought were particularly impactful. The first theme was the decision to seek emergency care is motivated by severe pain and disability and or fears about a catastrophic diagnosis or prognosis. That makes perfect sense, right? If you are in severe pain that's causing disability and you're afraid that something catastrophic is happening, of course you'd go to the emergency department. That's absolutely the right place. So one of the quotes from this patient was, "When I woke up the next day, I couldn't stand up at all. I was in horrifying pain. So I came to the emergency room." One patient said, "I'm wondering, will I be able to walk? Is it going to be normal? Is my life getting ready to change? Is this that moment where this life changes forever? And who I was yesterday and who I become in the future are different?" That's a valid concern. And then this other patient says, "I was scared. I was really scared because I don't ever want to feel that pain again." That absolutely speaks to the pain experience and how we can help patients learn not to be afraid of pain experiences that might happen, but also what a normal reaction to have to be afraid of severe debilitating pain. The second theme was patients sought various goals from their ED visit, but emphasized the primacy of pain control before pursuing any other objectives or assessments. So they really felt like the most important thing was to get the pain controlled first and then try and figure out the cause and figure out what to do. And in this case, this quote really just summed it up. Control the pain first, then we can do something. So even if your patient isn't getting pain medication, one thing to consider when you're going into that room with that patient in severe pain is, how can I use my strategies and techniques to reduce their pain before I start asking them to do things or start really examining them more carefully? What can I do now to help reduce the pain so this patient can move forward? Then the next theme was participants were reluctant to use medications for pain control, but also acknowledged that medications help to achieve symptom control. That makes sense. So the patients in this study really did demonstrate an understanding that pain medications can be addictive and harmful, but they also felt like they did in some cases have a place. One patient said, I prefer hearing about therapy more than medicine. I was glad for the medicine to relieve the initial pains, but I didn't want to depend on it." Perfect. Another patient said, "Moving forward, I think the part I really wanted not to do was become codependent on the medication. I wanted to be able to move and do the things that I was able to do prior." Okay. Patients perceived a number of benefits from an integrated emergency department physical therapy care model. Absolutely awesome. I love that. So the quotes here that were amazing were, "So for me, it was good to be able to have a physical therapist come in and just reassure you." Huge part of what we do in the emergency department, reminding people that they are okay, they are safe, and it's okay to move, and it won't be like this forever. Having somebody from PT come in and say, "We can do something that's non-invasive and is going to help you and that it will work." Again, reassuring, future oriented, and something that you can offer the patient that doesn't have a lot of harm associated with it. And two of my other favorites. So yeah, it's like, I love PT. Let me just say, I love it. Who doesn't? "I was totally sold at this point. I think it's the most important thing, frankly. I think it's great. I think everybody should see a physical therapist." Totally agree. And then finally, pain was a barrier to participation in physical therapy exercises, but ultimately the performance of physical therapy exercises facilitated recovery. Perfect. That's exactly what we want to communicate to patients, that while pain may be a barrier initially, if we can get you moving, physical therapy will make a bigger difference in the long run. And then I like this quote here at the end. It wasn't easy in the beginning. That's why sticking to it is important. In the beginning, you're in pain, but you do feel stronger and mentally stronger. I can overcome this and I can control what's going on in my body. Absolutely perfect. I love that attitude. I love being able to share that with patients and really understanding what the patients were experiencing when they came to the ED and what their perceptions were about physical therapies and intervention. So I'd highly recommend you check out this article and read it. You can find it in the Annals of Emergency Medicine. This is published in 2023, so brand new. Take a look. Patient perspectives on seeking emergency care for acute low back pain and access to physical therapy in the emergency department. Check it out.